Hi, today we're going to go over how to chart preview or scout a patient's medical record. What you want to do first is to bring up the patient's medical record. One, you can do it through the patient lookup icon. If you know the patient's medical record number or their last name and first name and date of birth, or you can go to your inbox and select the appropriate provider's patient list and then double click through there. Once you have the patient's record up on your screen, you want to go to certain areas to preview the patient's history. So in this case, we're using here a testing patient, so some details might not be there, but you look for the intake template. This is normally started by the MAs when they bring in a patient and check vitals and chief complaint. If an intake template is not there, you can choose to refresh the patient history pane. That should make the intake template available. If it is not available, it just means that the MAs have not started the intake template yet. However, though, you can still go over other areas of the chart before that happens. So in terms of the intake template, the most important parts here are the chief complaint, and sometimes the MA might give you some details of the chief complaint. Some other times you might just have abdominal pain, for example. That's the only thing available. The other important thing to notice here is vitals. Vitals will give you an idea of how the patient is doing based on their chief complaint. The other thing to notice here is allergies, which you can also just hover over the allergies above as well, and you can see if they have any allergic reactions to certain things that you might consider prescribing. The other area where you want to consider chart previewing is medications to see what the patient is currently on. So you can access medications by this icon here or this icon down here. It will take you to this screen as well. And here you can see what the patient is currently taking. Likewise, if you want to see any previous lab orders that they have had, you can go to the lab order icon, which are here as well. If there are no labs here, it just means that the patient has never had a lab drawn at Venice Family Clinic. Master IMs tell you the previous HPI why the patient came in for, as well as the assessment and plan for that. Obviously, this is a testing patient, so there aren't that many details here, but an actual patient would have a lot more details from the providers. I recommend that you see the past 2 to 3 master IMs to see what has been done for previous problems. The other area to be aware of is if you see in the master IMs that the patient was supposed to obtain some imaging or go to a specialist in the following months, sometimes those results are available in categories. Categories will have the different folders here listed, such as medical notes, radiology for any imaging, or sometimes even a lab folder for other outside labs that the patient might have obtained at an outside facility. The other area that's underutilized in the medical record, it's the home icon. And the home icon basically tells you all the previous HPIs and plans that this patient has had. So this is another area where you can sort of follow a problem through and see what was done or what has been done for that problem. Any diagnostics as well will be listed here, labs. So this is another useful area of the chart. Lastly, if the chief complaint happens to be like a UTI or burning on urination or something along those lines, and you want to see if the MAs have already done a urinalysis, you can check that in standing orders. Results will be available in this box here down below. I think that concludes this video. Thank you for watching.